so here we are for our last video for HSC PDHPE Core 1 Health Priorities in Australia. As usual, we've saved the best for last. It is certainly probably the largest dot point of the rest. And the other thing is that pretty much every single year in the HSC, there will always be a or multiple choice questions on this dot point, and also some sort of short or more likely long answer response from this dot point. All right. So I'm going to cover this over a couple of videos, but the main learning that you need to have regarding this dot point is examples, and that is what we're going to be focusing on in our class time. All right. So I'm going to give you 4 examples overall, 2 in these videos and 2 which are going to be fleshed out in a lot more detail in class, which you can then use in your answers. So, the dot point. Health promotion based on the 5 action areas of the Ottawa Charter. On the left-hand side of the syllabus, it says that we need to cover 4 things today. 2 in this video and 2 in the next one. Levels of responsibility for health promotion, and the benefits of partnerships in health promotion, e.g. government sector, non-government agencies, and the local community. On the right-hand side of the syllabus, it says that we need to argue the benefits of health promotion based on individuals, communities, and governments working together in partnership. Argue the benefits of health promotion based on the 5 action areas of the Ottawa Charter. Investigate the principles of social justice and the responsibilities of individuals, communities, and governments under the action areas of the Ottawa Charter. And critically analyse the importance of the 5 action areas of the Ottawa Charter through a study of 2 health promotion initiatives related to Australia's health priorities, which is what we're going to do in class. Let's go. So levels of responsibility for health promotion, and before I go through the levels, I just sort of need to remind you as to what the Ottawa Charter was. So the Ottawa Charter, developed in 1986, outlines 5 action areas, and what it is basically, the purpose of the Ottawa Charter is that it shows that if all 5 action areas are applied to health promotion initiatives, they will be successful, okay? So our 5 action areas are developing personal skills, creating supportive environments, strengthening community action, reorienting health services, and building healthy public policy. And the catchphrase, to remember it, dead cats smell really bad. It's true, right? So rub this off and then we'll go through our levels. All right, so the first levels that I want to cover are our government levels, all right? So health promotion is the responsibility of governments, communities, and individuals all working collaboratively to achieve better health outcomes. So we know that there are 3 levels of government. You've got your federal or Commonwealth government, state governments, and local governments. So your federal government writes policy, okay, distributes funds and allocates resources to achieve health equity and create supportive environments across Australia, all right? The state governments take what the federal government have done, okay? They then develop their own healthy public policy and apply it directly to the members of its state and or territory, okay? Making sure that it is in line with the federal government policy that comes from above. They will also deliver initiatives to the public via media, such as like all of basically the road safety stuff that you see on TV is run by the New South Wales state government, and all those recommendations are handed down from the federal government, okay? So via media and, campaigns, billboards, advertisements, internet stuff as well, all right? So that all comes from the state government side of things. Then our local government, so our local, works directly with communities, all right, to achieve health promotion and awareness. So the local government will know of its communities within itself and where there are issues and particular issues, and therefore it can focus on delivering health promotion initiatives there. Local governments will often develop partnerships with local businesses to create supportive environments, okay? So, they might run like an awareness day on the weekend about mental health. Lake Macquarie City Council in conjunction with Warnes Bay High School Mental Health Initiative, okay? That type of stuff. So there are our levels of government. But like I said, the main thing that you need to get from this are examples. And like I said, in class, we're going to go through 2 examples. So just as a heads up, we're going to go through the National Tobacco Strategy, okay? And we're going to go through the Head to Health initiative, which is focusing on mental health. And those 2 initiatives, we're going to look at how the levels of government impact them each, okay? And then what are the roles of the 5 action areas of the Ottawa Charter as well with those initiatives. Okay, so that when you get a question that says, explain the levels of responsibility for health promotion for a health initiative of your choosing, you can then go with Head to Health, or you can go with National Tobacco Strategy, and you basically go, the federal government does this, the state government does this, the local government does this, this is applied through, developing personal skills, creating a supportive environment, and here are the examples that all link to the initiative. So make it all nice and pretty. Okay. So our last couple of levels, we've got communities and individuals, all right? So communities and local governments, pretty much the same thing, but within local governments you can have communities, so we do need to break it up. So communities will develop partnerships with various health organisations and deliver these campaigns to increase awareness and educate their members. For example, Cancer Council having a partnership with the Newcastle community due to skin cancers, right? Because lots of people here go to the beach and, get the tan on. So that would be a really good opportunity to increase awareness, educate individuals, maybe get your skin checked, maybe don't go out the sun between 10 and 2, etc., etc. As opposed to people that live in Thredbo, okay? Skin cancer is not very high. So we've got to, deliver these initiatives where it is most effective. And lastly, you've got individuals, all right? So individuals have two roles. So they need to feel empowered to make change, okay? Accept advice and education on health promotion and actively decide to implement these measures, all right? And this is sort of one of the reasons why they came up with the Ottawa Charter, was we can have all these great ideas in the world, but if the individual themselves don't actually decide to take it on, then it's useless. So that's where that word empowered comes into it, and you should always use that in your answers, right? So we need to basically give all the individuals enough knowledge and enough resources and enough time to make change, and also make them feel like whatever change they decide to do is going to make a difference. That's where empowerment comes from, okay? Individuals are also responsible for promoting health in their local community, in their workplace, to their family, to their peers, etc., okay? So we should have this domino effect, all right? If we can just reach one person who's very, loud and outspoken and they've had health improvement, that person should then become a spokesperson and be like, hey, I did this thing and now I don't have this issue anymore, and you guys should do that too. So maybe you should stop smoking because now I feel great, or maybe you should stop drinking because now I feel great, or maybe you should stop tanning between 10 and 2 because now my skin's not all leathery and thick and stuff and I don't have flakes and whatever. So, yeah, individuals, very, very important role. Okay, so that's the level of responsibility for health promotion. I'll cover one more dash in this video and then we'll call it. All right, so your second dash is looking at the benefits of partnerships in health promotion, okay? So improving health is a shared responsibility, okay? So you look at those levels from before, it's not just one person or one part of the government's responsibility, it's everyone's responsibility, okay? Successful initiatives are those which involve multiple sectors and avenues to raise awareness, educate individuals, create supportive environments, such as in your workplace, in your community, and at home, and therefore implement change, all right? E.g., okay, just a very quick example, you look at the immunisation package that the government puts out, okay, so it's publicly funded by the government, so you don't have to pay anything to become immunised against certain diseases and illnesses. It is encouraged by medical professions, so if you go to your doctor or GP for a regular checkup, they'll also check your immunisations and go, do you know you're due for this or whatever, or you should think about getting this. Immunisations is also therefore then delivered in schools, okay, so you don't need to book in to your doctor and whatever, you literally just rock up at school one day and you get your jab. And also there are restrictions placed on people who are not immunised. Now this is mainly just done in the private sector, but I do know that there are private daycare facilities out there that will not take their children, that will not take children who are not immunised, okay? And there are also government incentives for being immunised, For example, if you're not up to date with your immunisation schedule, they can, cut you off for family payments, etc. So there's a whole, different multifaceted, approach to encouraging people to get immunised. Now, the benefits of an intersectoral approach in health promotion, which is basically the benefits of partnerships in health promotions here, the 4 main benefits, okay? And these are the things you would need to talk about if you get a question like this. Number 1, greater capacity to tackle and resolve complex health problems, e.g., collection of experts, okay? So you look at COVID-19, all right? If COVID-19 was just the job of Warners Bay High School people to solve. I'm not like discounting our intelligence here, but we probably would be very limited in our scope and sequence of what we were thinking, okay? However, if you then expand that to all schools in New South Wales pooling together their thought process to how to solve COVID-19, you'd probably get actually a much better, not only answer and response, but a better way to tackle that issue, okay? If you then expand that further and say all schools across Australia are going to work collaboratively, via Scope and Zoom and whatever it is, to fix COVID-19, you'd probably get an even better answer than all of New South Wales schools put together, okay? So you can see that the more experts and the more people that you can put together thinking to get collectively on solving a problem, the better the outcome's going to be, all right? Now, secondly, you've also got a pooling of resources, such as money, all right? So you look at COVID-19 again. Let's say that each school in New South Wales was given $1,000 to solve COVID-19. Well, probably not going to be able to solve COVID-19 with $1,000, okay? However, if all the schools in New South Wales put their money together, all of a sudden you've got $10 million to solve COVID-19. That's probably more achievable. Let's do that. Reduction in duplications of efforts, okay? So if individually a whole bunch of different sectors are working on a health issue such as COVID-19, it means that New South Wales state government might put something out, and the Western Australian government might put something out, and the Northern Territory might put something out, okay, which is all basically the same thing, but that same resource that they have developed took weeks and weeks to put together, and hours and time and money and all that kind of stuff. Whereas if they all just said, okay, New South Wales, you do the resource, Northern Territory, you work out how it's going to be facilitated, Western Australia, you work out the different types of media we're going to use for that, etc. They're all going to be working sort of collectively, but there will be no duplication of effort because everyone's got their distinct role, okay? So it's a much more efficient way of using time, money, people, resources, etc. And lastly, the new collaborative ways to work together, okay? So this is like using technology, okay? So not only do we have to collaborate with just the people here, you can do it on phone conference or even, video conference these days. And nowadays, with the internet in the state that it is, you can collectively and collaboratively work on health issues with people from all around the globe, okay? So, we talk about the World Health Organization, which is part of the United Nations. Those people used to actually have to all fly to be in one building together to work on issues. However, during COVID, with the internet, boom, like that, video conferencing there and then, let's talk about this issue. And they would be able to check in like daily and if not multiple times every day to see how their efforts are going in solving the problem. Yeah, so that's the benefits of partnerships in health promotion. I will finish the video here and we will pick it up with our next dot point, which is, having a mental blank, how health promotion is based on the social justice principles. Next. Thanks, bye.